Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to tackle Canada's problems with drugs, addiction, and crime. Today, we'll be talking about crack pipes and meth pipes and how Canadian governments are giving out this paraphernalia in astronomical amounts. A recent media report, which happens to have been written by me, exposed how the city of Toronto has given out approximately 500,000 meth pipes and 500,000 crack pipes every single year since 2021. That's a wild number and one that raises questions about whether the city's harm reduction strategies are enabling addiction and public disorder. Joining us on the show today is Daniel Tate, Executive Director of Integrity TO. His organization is an independent Toronto based civic advocacy group focused on municipal accountability and opposing ideological governance. Late last year, he submitted a Freedom of Information request to the City of Toronto demanding that they disclose how many meth pipes and crack pipes they give out per year, which is how we have this data to begin with. Otherwise, it would be private. Welcome to the show, Daniel.
Hi, Adam. Thanks for having me.
So, Daniel, what prompted you to force the city to disclose how many meth pipes and crack pipes it distributes each year?
Yeah, I've been very disturbed with the amount of drug paraphernalia that's been littering our city streets, parks and playgrounds, transit system, et cetera. We've seen a proliferation of crack pipes, meth pipes, and other supplies all over the city. Even before these harm reduction or safe consumption sites were closed, we've seen an increase over the last 4 or 5 years. And so I just really wanted to get more visibility and transparency on what's going on. Why is there so much drug paraphernalia and why are we finding them on our city streets?
And what was your response when you saw the enormous number of crack and meth pipes being given out by the city every single year?
I was blown away, absolutely blown away. I thought maybe it'd be in the low thousands, maybe, but it was in the millions. It was an astronomical number. I almost fell off my chair.
And how does it make you feel as a taxpayer?
It feels like a betrayal, is what it feels like. This is not what taxpayers expect their money to be used for. There's a bargain or a deal between taxpayers and city government on the services that they are supposed to provide in exchange for us relinquishing a big chunk of our hard earned money and buying millions of needles, meth pipes, and crack pipes to facilitate harmful drug use and abuse is not part of that deal.
Now, your Freedom of Information request also asked the city's bureaucrats to disclose how much money is being spent on the acquisition and distribution of these pipes, but they declined to share this financial information. What do you think about that?
It shows that they're hiding. They're hiding something. Maybe they realize it's a political liability or it's a bad look on them, which it is. But we want to know because this is public money. This is our money, and it's any law-abiding, honest, hardworking citizen of Toronto should absolutely be aware where their money's going, especially when that money goes to places that bring back a lot of disorder and destruction on our city streets.
Well, so you say that you feel as if they're hiding. Does it seem as if there's a culture of secrecy around harm reduction programs in Toronto more generally?
Yeah, I would think so. I don't think there's enough transparency in terms of how much of our money is being used to facilitate not just the programs and the supplies, but the facilitation of this ideology, this sort of drug liberalization, drug normalization ideology that is really starting to entrench itself at city institutions. There are harm reduction academics who put forth studies to say harm reduction is the greatest thing since sliced bread and you shouldn't question it. All these things absolutely need to be questioned. And that's really what my efforts are focusing on.
And from my understanding, city funded organizations are even training youth as young as 16 years old on how to distribute crack pipes to addicts. I mean, that's shocking.
Yeah, it is shocking. Unfortunately, to those who are involved in these activities, they think it's normal. They think it's appropriate. They think it's healthcare, which I think is absolutely outrageous. Inviting 16-year-olds, who are basically kids, their brains aren't fully developed, inviting 16-year-olds to your quote unquote health center down at Queen and Bathurst in downtown Toronto to create loot bags of needles,
Daniel, Daniel,
meth
Daniel,
pipes,
we're
and
going to
such.
go to a
It's
break right
weird.
now, but we're going to get into larger
Okay.
context when we get back in a few minutes.